So, being here back on the scene of my location where I do my hospital calls and different things like that, I've gotten sort of settled into my night and got here, earlier in the afternoon, get the lay of the land, see what moms, are laboring, see who may need, other help, education, maybe, you never know what walks in the doors. So I got a chance before coming here to spend some time with my daughter. I said in my last segment about the whole ankle twisting thing, and she's fine. Thank God. And we got a chance to do our Netflix thing and to sit down and watch a crazy movie that made both of us laugh and all of that good stuff. And so that gave me an opportunity to really just kind of relax and, just let go for a little while before coming, into something that, can be fairly intense. Delivering babies is a wonderful thing, but there are emergencies that happen that always, can kind of be a little intense when it comes to the thought process and what's next and what we need to do. Even when moms, their lives can be in danger, we also have to be on top of that, making sure that we have a happy, healthy baby and a happy, healthy mom. So for me to decompress before that time is really, really vital, so that my brain is working and having proper rest. Although I didn't sleep the greatest. The nights before, in terms of trying to turn off the brain. I think that my ride in was a little bit more relaxing, and I got a chance to kind of decompress a little bit more on my ride in, because it's usually about 3 hours or so to this particular location. So, what I wanted to turn this into, though, is I did want to turn this into an educational talk and not just be sort of a day in the life. I think, the idea of seeing a day in the life is great, but I always want to bring my videos back to being educational and sharing something that's valuable. And I think that, in the idea of the day of the life, what I try to put out there is the idea that making sure that you have proper rest, making sure that you are focusing on you, making sure that you get an opportunity to really decompress in between intense jobs can be, or not can be, but it is very, very vital and important to do. And I think that there are a lot of physicians out there where we all just go, go, go. And we often give ourselves to medicine, but we don't necessarily always give ourselves back ourselves. And that's what I'm hoping that not just for physicians happens, but even for people who just watch these videos in general. So there are two topics that I want to cover here. One, I'm going to cover very briefly because I think it can be a very controversial topic, but also one that I think is important for us to highlight, because I don't know that people really understand the gravity of it when it comes to us as physicians and the role that it can play in their care, in people's care. But not only that, but looking at the fact that we are human beings too, and we have feelings, and understanding that is vital because we too understand that we, see patients, and patients have feelings. And that's the reason why it's really important for me to be able to be an educator for my patients, to take the time. And in medicine today, it's not always that we have the time and opportunity to provide education on the level that we prefer, but I do sincerely try to take time with patients, which is why I've chosen some of the roles that I've played over the years, and also chosen not to continue certain roles, because I have always felt like my goal is to provide education, because education is power. It is sincere power when it comes to being able to make the right medical decisions. There are some people that are making really hard decisions, and not having the medical knowledge is not good when it comes to what they may think later in terms of coulda, shoulda, woulda. I try to make sure that my patients don't have any regrets because they have had all of the options and information presented to them, so that they are truly making an informed decision. But that also lends itself to, in the African American community, one where when we try to provide education, some people can look at that as a way of us being condescending in some ways. So basically what happened tonight is I got a call from one of my really good friends that I we've worked together in terms of us bouncing stuff off of each other, making sure that our medical knowledge about certain things is just, impeccable. Making sure that we are each other's resource because we stay well read. And if there's a, split moment decision that needs to be made, we can call each other on the phone and say, look, I had this situation. I need some help with this. And we're really good about that. And I love that, having that, because I have a few friends like that in medicine that are really good friends. And I can call them at any time and ask them, tough questions, and they can do the same with me. And I think that that sense of collaboration is very important, but it's also very important for us to be able to collaborate about things that will impact our mental health. And my good friend called and she said, I was really upset, and I really was what word did she use? She said, I was upset and I was hurt. I had a patient, I was explaining to them, sort of my reasoning behind how I was how I was going to provide their care, and how I wanted to provide, certain things and within their care. And I ended up receiving a call from the charge nurse of the unit after I, gave all of my explanation as to what I wanted to do, or, giving them their options, and was told that they fired me as a physician because I was rude and condescending. And she said, I was really hurt by that because I couldn't understand why. And so she went ahead and she explained this interaction. And the one thing that she explained was that when she went into the room, because she lives in a state where the COVID numbers are increasingly steadily every day, and she's a physician, and we are not only trying to protect us, we are really trying to protect our patients, because we don't know which patients we've encountered that may actually have been exposed to COVID. And so I do it because I'm really trying to protect my patients. It's not because I'm trying to be mean or I'm trying to be rude. But she just simply asked, can you put on your mask? And the patient said, I'm eating. Okay, that's reasonable. But at the same time, I think it's also important for patients to eat. But when the physician comes in the room and we're trying to explain how we plan to proceed, or how we'd like to proceed to give, patients information, many of them, because they really are interested in understanding what it is that we're trying to say, will push their trays to the side, and eating becomes a secondary thought because they're thinking about themselves and their baby. And especially when it's a high risk situation where, there has to be intervention, and intervention may have to be immediate. And so I think my friend was taken aback by the response, thinking like the gravity of the situation, and maybe the patient doesn't quite understand the gravity of the situation. So the exchange continued, and the patient had a family member there. And as my colleague was trying to explain what was going on and what the possibilities were in terms of what needed to go on in the very near future, the family member essentially just kind of snapped at her, and she was again confused, like, she had given the family member a compliment, not quite kind of, understanding where, sort of the snappiness is coming from, the patient and the family member. And so, one thing I think in this exchange is everyone was African American. And so, in the African American community, for a lot of African American physicians, what we really try to do, and we do this for all of our patients, so it's not that we're singling out any one patient, but because many African Americans do share same experiences, there is sometimes a foundation that we have that are similar in terms of our ethnicities and our backgrounds in general. And so when we try to have conversations, sometimes, some of us try to draw on those commonalities so that we can make the process a bit easier and the discussion with patients a little bit easier. It's really cultural competency. It's in all sincerity, because you really also have to do that with every other race. And you may not necessarily be ethnically the same, but you do have to understand the cultural competence, within that particular race, and what things, are reasonable and what things are completely unreasonable in terms of sort of your interactions. And this is one thing that I think a lot of people in the United States are lacking, and why we have so many difficulties when it comes to race and ethnicity. But in this particular case, my good friend really felt like much of this had to do with the fact that she was African American, and I too have experienced this, where I have had many of my African American female patients literally go off on me, call me out of my name. I mean, just awful things. And I have had my, very good friend, white counterpart, go in, and the attitude is completely diffused. And it's not even because of anything that she said. It's the fact that she's walked in the door and she's white. And so one day she and I were actually talking about an interaction with a patient who called me out of my name, the B word, everything but a child of God, which I had never encountered before. That somebody would be that rude. And she literally came out of the room, my white counterpart, and she said, "You know what this is, right?" I said, "What is it?" I'm a white woman. I walked in the room. I told her what was going to happen, and everything was diffused. I was like, wow. She said, "Dr. Rush, this is something that we see all the time. I'm the white woman that walks in a room. Apparently, I'm not a threat. But for whatever reason, you are a threat, and they look at you that way. And this is why you often get the behavior that you receive. But when I walk in the room, everything is fine. And I don't say anything different than what you did. And I heard you outside that door, and I didn't say anything different than what you told her. I went in there and told her the very same thing, and she's perfectly fine." I was floored. My heart, I just get heart palpitations thinking about that right now. I was floored. I was hurt. I was in just disbelief. I just could not believe what I was hearing. And to know that I have worked so hard, I have worked so diligently, but to only be reduced to an interaction like that, and have had multiple of them with people of my own race, more so in some cases what I may have had with people in other races, I was hurt as well. And so when my girlfriend called me tonight, I completely understood exactly what she was experiencing. And it was shameful. It was hurtful. And your sense of everything is just all discombobulated in your mind. You sometimes, I think some people get to a point like they ask themselves, like, why did I do all of this? My skin color has reduced me to being less than, even though I have probably had to work 10 times harder and in some cases be 10 times smarter. And I am reduced to interactions like this. So I wanted to put this out there because I think that it's something that a lot of people don't talk about, and because they're afraid. But somebody has to say something. We can't keep allowing the pink elephant in the room to exist and not address it. We have to start looking at these things. If Black lives matter, then I think all lives matter. But at the same time, we are all not oblivious to the fact of the things that do occur from a racial and ethnic standpoint that are just aberrant, crazy, makes no sense, and we need to start fixing it. But the only way that we can fix it is if we talk about it and we also educate. And education, again, is power. And ignorance can mean so much detriment to so many people and so many things and so many processes. And that is why education is something that's very important to me when I talk to my patients. And not about race and ethnicity. It's just really about their health, because we're all humans. We all bleed red. That's the bottom line. So while there are still those racial and ethnic differences that we all have to understand and be, culturally competent about and for, we still are all human beings, and health is something that we all have in common. Now, there are things because of differences in races and ethnicities that may change the risk factors of things we may be at risk for, or it may change how we experience our health and our health experience. But at the same time, we do also have to start addressing some of the things that have been an issue for years, and the disparities, not only for physicians, but it's for patients as well. But again, we can only but do that if we start to have a conversation. Since I've kind of done my a day in the life and brought this topic to light in these video segments that I just kind of all meshed and put together. I'll see how this turns out in terms of what viewers think, and if they think this is something that they want more of. I think my next segment, I am going to talk a little bit about the other topic, which is going to be weight gain in pregnancy. I've talked about a lot of gynecologic topics, but I really haven't covered many obstetric topics. And so as I was talking to my girlfriend, I said, what is plaguing your practice right now? Not really plaguing your practice, but what do you think people need to hear about? And the first thing she said is weight gain in pregnancy, because everybody comes in and they think that they can gain 30 pounds and they always, or more, and they always want to say, well, the baby wants macaroni and cheese. She always does these analogies, these things that she comes up with, and I think they're cute. But they're true. They're actually very true. That's the reason why I think it's funny too. So I'll talk about that in my next segment, and then that'll be the other educational piece of this, and we'll go from there, guys. So I really hope this was helpful. This was not meant to be inflammatory in any way. It was not meant to be anything disparaging. It was not meant to, talk about who to treat better, who to treat worse. We're all human beings, and as physicians, we have to treat everybody the same. But at the same time, we're not treated the same. And that's what I'm trying to highlight here. And bring to people's attention, because I don't think that people understand that this actually exists unless they've actually experienced it themselves, or they've been on the other end, like my girlfriend, my white counterpart, who had the experience with me. So I hope that if there are comments, there are great ones. And if there are questions, and there are reasonable questions that can be answered, from a reasonable standpoint and not from, some inflammatory place or, some place of bigotry or anything like that. So again, hope this was helpful. I'll talk to you guys very, very soon, just a few minutes, but it's going to be a different video. All right, guys. See ya. Bye.